Thank you very much indeed, dear chairman, dear colleagues. It's a huge pleasure. Actually, in Barcelona, there's another congress going on right now, which is in actual presence, which is the ATTD. And as president of the DFSG, I'm very pleased to know about that and to be here as well. So why do we care about diabetic neuropathy? Well, that is a silly question indeed, because as already said, it contributes to diabetic foot development, to neuropathic pain, to gait disorders, to cardiovascular morbid mortality, to erectile dysfunction, depression, and others. So we'll be talking about 1 and 8. And skin disorders of diabetic neuropathy will refer to neuropathic diabetic foot ulcers, which is a subject already and repeatedly touched upon these 3 days, but it is a skin disorder, if we would like to put it this way. Hyperemia in the foot skin, dry foot skin, and gustatory swelling, which is not manifested in the foot, obviously. So this is the neck of a bottle, and it reminds us of a typical neuropathic ulcer, which is circular with smooth borders and moves to deep underlying tissues like the bottle, like the neck of a bottle. And it justifies the old Latin name of malperforans, which means that it is a perforation, it is a piercing to underlying tissue. So an ulcer is a defect through all layers of the skin, and that is a historical definition by my mentor, Mike Edmonds. And indeed, this is a typical neuropathic foot ulcer in an area of high pressure, which is a third metatarsal head. As you see, it is circular with smooth borders. It is piercing to deep tissues with the danger of reaching the bone. It is clean, uninfected, and there's this yellow surrounding tissue. As you may judge from the skin, it is a young person at this time. So on the right panel, we're going to see this typical neuropathic ulcer, now as a scheme, which should be contrasted with an ischemic or neuroischemic ulcer, which, I repeat by contrast, is not in areas of high pressure, but in the border of the foot. It has irregular shape, dirty appearance. It is painful and not painless. It is usually in elderly people. The skin is ischemic, cold, and without pulses, which is in contrast with the absence of ischemia, younger person, deformities typical of neuropathies such as the claw, toe here, and localization in a high pressure area, which is the neuropathic foot ulcer. So to summarize, it is circular or semicircular with smooth borders, painless typically, located in high pressure areas. It may extend to deep tissues. It is surrounded by callus, and the formidable complications include infection and osteomyelitis. In more severe cases, so this lady has lost already 1 hallux. There's plantar arch collapse. You see callosity here, and you see all the deformities in this foot and a neuropathic ulcer in an already deformed foot. And to make matters worse, you see this lady with bilateral shark osteopathy and antecedent history, antecedent toe amputations, in which case you see there's no plantar arch, and neuropathic ulcers develop due to pressure again, but in abnormal areas, because normally these areas should not be on the ground. So therapy includes, as you're aware, offloading, surgical or alternative debridement, treatment of infection, and other. Now, point number 2 is hyperemia, which obviously refers to increased local blood flow, impaired vasomotor reflex, and it is attributable to cardiac autonomic neuropathy. In this case, it refers to the nerves of the small vasculature, and it is manifested as red, warm, humid skin in the foot with very strong, palpable arterial pulses, which in British English are called bounding pulses. It's like the bounding of a ball. So bounding means very strong, too strong, +4. and distended veins in the foot dorsum, described, if I'm not mistaken, first by the late Professor John Ward of Sheffield. So these distended veins which bring to our attention the presence of neuropathy. Now, dry foot skin, as seen especially on the left panel, is attributable to reduced sweat production, which in turn is attributed to reduced innervation of sweat glands and reduction of their size, leading to propensity for callus in high-pressure areas, as we've already seen, and therapy including urea creams, offloading, and appropriate footwear. Now, neuropads, as seen in this narrative review of almost 10 years ago, is a simple, non-invasive indicator test which diagnoses dry skin in the foot, but also has been used as a measure of diabetic neuropathy, at least as a screening tool, as we have repeatedly shared. Which brings us to number 4, a traditional complication of neuropathy, which is not relevant to the foot, which is gustatory sweating. Gustatory is a Latin word like gastronomy, so it refers to food. So there's increased sweating in the face, in the neck, and in the upper chest, which occurs after eating certain foods which are hot, spicy, or Chinese. It is a measure, or rather an index of dysautonomia, and therapy includes avoidance of certain foods or even anticholinergics. So you see this scheme with increased sweating in the forehead, in the cheeks, and in the upper lip. So coming back to Barcelona, the main feature of our subject is neuropathic diabetic foot ulcers, which result from dry skin and high pressure. And we have briefly discussed other less common manifestations. And we're going to finish, if you will, with this editorial, which makes use of a verse by the Nobel Prize winner Irish poet William Butler Yeats. William Butler Yeats wrote a poem called Brown Penny, and penny, as you will recall, is a British coin. So the little boy was throwing a penny to see if a little girl loved him. And the poet was saying, talking of love, but one cannot begin it too soon. And this editorial is reminding us that neuropathy may occur very early in the course of diabetes, or even, as we have shown and reviewed, even by exception during pre-diabetes. So we shall never tire of talking about neuropathy, its manifestations, unusual manifestations such as gait disorders, usual manifestations which you and we are aware of, and skin disorders, which has been the subject. And thanks very much again, indeed.